Hello. This afternoon I'm going to go over coronary artery disease. It's a presentation I'd like every new patient to have to learn a little bit more about coronary artery disease. As you know, most of us will die from heart disease as it is the #1 killer in the United States. This is different than any other disease that you deal with. If you have a pneumonia, you take antibiotics, you're done. If you have appendicitis, you take the appendix out and you're done. With heart disease, this is something that we deal with for the rest of our lives. To be able to fight this disease, you have to understand the process. I want to go over the slide with you and see if we can't convey the message. We're born with a normal artery, 3 layers, beautiful. This is the lumen, this is a slice of the artery, this is where the blood flows. Early in life, believe it or not, we start building up cholesterol in the wall of the artery, both due to genetic and because of the ingestion of cholesterol. This patient here has about 50% blockage. This patient will, for the most part, not have any symptoms, and even doing a stress test, the stress test may be totally normal. It is not until we get to about 60-70% lumen filling when we start to have symptoms. Unfortunately though, most heart attacks happen or occur in a vessel that has 50% or less blockage. And the reason for that is that if we fill the cholesterol pretty quickly and do not give the vessel time to heal and recover, as you see, this vessel wall will thin out and becomes vulnerable to rupture. This is just an illustration. As a matter of fact, the thinning does not occur here, it occurs at the edge of the lesion, and of course other factors like inflammation can play a role. Now, one day we are upset, blood pressure is high, heart rate goes up, and the stretch in the vessel causes this thing to tear, this wall to tear, and that will expose the cholesterol of the atherosclerotic material to the bloodstream. Now, what does the blood do if you cut yourself? It is designed to clot to prevent bleeding. The blood here thinks that we have a wound and acts as it was designed to clog this bleeding and to stop the tear. In doing so, it blocks the artery and stops the blood flow to the heart and causes a heart attack. So the treatment of heart disease starts here, starts early, and it is a continuous process that has to be done all the way to the rest of our lives. So few things that we need to do. One, prevention, lowering the cholesterol, exercise, controlling blood pressure, stopping smoking, and exposure to smoke are some of the things that we need to do to try to prevent that process.